Hi, I'm Meshal Malik and you're watching Indus Special. More people are going hungry, states the United Nations in its annual study on the state of food security and nutrition across the world. And those rising number of people who are without healthy and adequate amounts of food are mainly concentrated in Asia and then Africa. With a plethora of issues plaguing our food systems, are we headed to the United Nations estimate of an increase of 840 million people around the world being undernourished? Let's discuss this further. Joining us for this conversation, Ms. Lilia Smelkova, who's an expert in food, agriculture, and nutritional education. She joins us from Geneva. Also joining us is Mr. Claudiu Eduard, who works on sustainability challenges for phosphorus, a resource essential in agricultural production. He also is the founding member of RASMI, a center that is focused on bringing scientific and civil society expertise to advance sustainable development in the EU. He joins us from Iceland. Thank you both for joining us and a very warm welcome to this show. Lilia, let me begin with you. Now, when we talk about hunger rising across the world and these numbers continuously going up and up, even though in 2030 we were supposed to move towards zero hunger. What do you make out of this? Why do you think that number is going up?
Sure. So I will tell you an incredible number that I don't think many people know about. In 2014, the world produced food enough to feed 12 billion people. And we are a little less than 8 billion today. So the most of that, 40%, is wasted. And wasted due to different reasons. In rich countries, it's wasted after the supermarket because people buy too much. In the countries where the supply chain before the supermarket is weak, it's wasted from the field to the production facilities and to the places where the food is sold. So I think that the number one thing is to think about not how to produce more, but how to waste less food that we already produce around the world.
Right. Such a great point. But Lilia, let me ask you this. When we're talking about how much food is wasted and we're doing a comparative analysis of sorts, is that useful given how localized food systems are? I mean, we're seeing so much hunger in Yemen, and then we're seeing issues of obesity in the developed parts of the world. So does it even make sense to say, oh, there is overall wastage and we need to focus on that?
Well, definitely. There is a lot of discussion now about local food production. And local food production would help to solve many of those problems, because if you take, for example, native breeds or native varieties of plants, they're more resilient to drought, they're more resilient to pests, and they are specifically developed over the centuries to grow in the location. So if we produce locally, we respect the biodiversity. The diverse system will be more resilient and give the opportunity for the farmers to have a short production chain, so they will receive more wages and more money for their crops and not the middleman. I'm not saying it's easy. I'm saying that a resilient system that will help us to support the people and to fight the hunger and also to fight the climate change is the local system. And that's where we should start going towards.
Right. Now, let me take that same point to Eduard and see where he views this matter of rising hunger across the world through his unique lens, through the work he does. Eduard, how do you see this?
I agree with Liliana. There is a big problem when it comes to food wastage. And only in South Asia alone, from post-harvest up to distribution, so we don't count here the consumer level, the Food and Agriculture Organization states that there's 20% loss. On the other hand, we also have, I would argue, the underpinning mindset that kind of triggers the system we have nowadays. So we should not forget we have a system based on consumption, and this system based on consumption fuels an economy based on growth. And we should not forget we have finite resources and we have certain planetary boundaries in the biosphere. And in that perspective, we cannot have indefinite growth and indefinite consumption.
Right. Tell me this. When you talk about sustainable development, we know that the EU is trying to work towards green recovery. It's perhaps ahead on the path of sustainable development than most countries, but we still know, as you said, that there's a big economic structure behind all of this, and that often creates resistance to move towards, sustainable development and also trying to produce sustainably. What has been the main pushback for the work that you do when we're talking about trying to become more sustainable for the future in terms of our agricultural produce?
Even if we look at the EU, there's been a big push from the post-war period up to the present to green the agriculture, to make the agriculture more sustainable, and increasing amounts of funds have been directed to green measures. However, we still see a focus of most of the budget going to harmful subsidies that are based on the same intensive and mass production of monocultures, for instance. So a big problem here is the way we're focusing even subsidies, for instance, instead of focusing them on more sustainable food production systems, we're targeting subsidies in Europe to large-scale farms.
Right. Come back to that, and we're going to dig a little deeper into that point you make. But before that, Lilia, I want to come to you. And since you deal with nutrition and education on this matter as well, something very important that has been stated by the United Nations when they're talking about trying to reduce numbers on hunger is that we need to move towards more healthy diets. What's the link between those two?
Well, what is healthy is what is also healthy for the planet, because we know about the beef production that it takes a lot of energy and a lot of water resources, a lot of land. And what is healthy for us is lots of fruits and vegetables. What is healthy for our heart and our diet. And it's also healthy for the planet. And what is important also that some countries that have also hunger, for example, in the United States, every sixth person is suffering from hunger, and they're receiving food stamps from the government to be able to eat. It's also the country with one of the highest level of obesity. So what we see also, because of the bad nutrition, many countries have both faces of the medal. They have obesity and they also have hunger.
That's an important point, that they also have obesity and they also have hunger. Now, I want to take your expertise and apply them to places in Asia and Africa, and why there's so much concern about rising numbers of hunger in these specific locations. What do you make out of it? What is happening in these regions?
Well, what I think is that the global production and consumption and also distribution of food is not a sustainable model. It's not a sustainable solution. If we think about the future steps, it should focus on local, on traditional, on biodiverse, and also low input agriculture. The agriculture doesn't need a ton of inputs in terms of pesticides and motorized labor in order to produce food that can actually be used for the domestic consumption, but not exported, as we see in many Asian countries where staples are produced for export instead of for the local market.
Right. Eduard, when we hear about local systems and we hear about using traditional means of production, something that's existed for centuries and for decades and generations upon generations are involved in it, do you think there needs to be a change in that in order to address this issue? Or do you think trying to rely on traditional forms of agriculture is in fact sustainable?
Traditional forms of agriculture are very sustainable, actually. They're based on low input, extensive systems. And we should not forget that we have throughout the world a highly unequal distribution of resources. So producing traditionally means, first of all, reducing the vulnerability and reliance on resources we don't have. And for instance, parts of Africa and parts of Asia are a clear example of that. And at the same time, it means we're shortening the food supply chains. So we're reducing the waste and we're reconnecting people to the farmers. We're making farmers' communities more resilient.
talk about that resilience a little more, because that's important to talk about, especially when we're having a conversation on climate change and adaptability. How can that resilience be increased? How can farmers be assisted in increasing that resilience?
I'm happy you mentioned climate change, because this will exacerbate the challenges that we face in agriculture. And of course, for instance, small-scale farmers will be the most affected. We're talking about a world in which 90% of the poor live in rural areas, and most of the activity in rural areas is agriculture. So basically investing in the small-scale farmer communities, making sure that the investment brings a holistic development and not just economical. I think that's very important. It's very important to develop not just the infrastructure in the economy, but also the social safety net of these communities.
Right, that is indeed very important, developing that social safety net for those that are not just the most marginalized, but who are the most vulnerable to what we're going to be seeing happening in the future, which are greater consequences of climate change. Lilia, on that very point of trying to create those social safety nets, especially for small-scale farmers, do we have examples in the world that have worked in doing that?
Well, there is a lot of great work done by Slow Food. It's an international nonprofit based out of Italy, and they work specifically on the community-based agriculture, bringing together farmers, chefs, producers, consumers, in order to know each other, to trust each other. So sometimes you might not need to rely, on a certification, but you know your person, you know the farmer who makes the production. And so this community-based agriculture has shown amazing results of cheese producers who can sell their cheese in the communities where before they were not recognized and not even respected because their product didn't look as nice as the one from the supermarket. And also amazing development of farmers markets, where the farmer can have a guaranteed source of income, but the consumer can also come and know that he buys local product, but not the one that is imported from somewhere of unknown origin, and the money stays in the community.
Right. That's an interesting example you give. I want to shift gears a little and talk about a report that has been released by the Food and Agricultural Organization, a quarterly report that talks about Asia and talks about Africa and why there is severe localized food insecurity. When we look at the assessment in Africa and largely in Asia, one of the main reasons for that is conflict and violence. Talking about that aspect and bringing that into the debate, how important is it? I mean, if we don't solve these external issues, can we even hope to reduce the hunger in the world?
I think this is one of the aspects that goes way beyond only the food production and the local community or life. But if you think that food is only part of the bigger culture, so every territory, every people has its own language, has customs, tradition, literature, and food is part of that. So I would look at the food links and the community work as a part of the bigger picture.
Right, looking at the bigger picture. Thanks so much for that insight there, Lilia Smelkova, and for joining us from Geneva. Eduard, on that same point, and since you're working on these systems and we are trying to do a comparative analysis, seeing why certain places are more vulnerable than others, how drastically does conflict, does violence impact areas that are already vulnerable, already susceptible to changes in climate, and are already facing a lot of food insecurity?
Definitely, it's a major obstacle for development and resilience for those communities, and it goes to show the multiple scales of work when it comes to not just conflict resolution but community well-being. So I wanted to mention on that note that you mentioned the conflict. We shouldn't forget that many times poverty is cause of conflict, and as I was mentioning before, we have most of the rural poor of the world's poor in rural areas. So first and foremost, working to develop those communities in the first place and providing opportunities for the youth in these communities through robust agricultural systems is part of the solution. But of course, it goes to show you the multiple scales that this needs to be tackled at national and international levels, because having conflict, having climate challenges, having economic challenges will make it increasingly difficult for these communities to develop, to get out of poverty. And we are witnessing a world with 2 or 3 speeds, where this social and economic inequality is just widening.
You mentioned here national level intervention and then international intervention. I want to focus on the latter here. Where do you think we're going wrong in our international interventions, because we're not solving the problem?
Yes, that's for sure. I think what we need is a systemic view. We need to really internalize the sustainable development agenda that the countries have been committing to. And unfortunately, lately we've seen countries going the other way in terms of, for instance, the climate agreement. So I think we need more coordination, more collaboration globally, and definitely a change from this wild. Well, I was saying that we should focus more on the sustainable development agenda that the countries have been committing to, and we need definitely more collaboration. And if anything, the current pandemic has shown the importance of countries coming together and keeping, for instance, trade corridors open and helping each other. And I think that's what we need. And we need to also have a closer look at regional solutions, local solutions, regional solutions. There is no one-size-fits-all solution. So then you can't just import one solution somewhere without any consideration of regional particularities.
On that point, thank you so much, Mr. Claudiu Eduard, for joining us from Iceland and talking to us about this. Now joining us is Musa Amir, who's a co-founder at Risk, a social enterprise aiming to combat hunger by making feeding convenient and food waste minimal. Risk has been recognized as one of the top 20 social enterprises of South Asia by DFID and has also received the Commonwealth Award. And their efforts have been recognized by the governor of Punjab. He joins us from Lahore. Thank you so much, Musa, for joining us, and a very warm welcome to the show. Now, Musa, you deal with both of the main problems we've been talking about, which is hunger and then food wastage. And you deal with it quite extensively on a national level. Where do you think we're going wrong?
I think one of the main reasons that we are going so terribly wrong in the other direction for both of these is the lack of seriousness in both aspects. And it stems from the fact, like, I will, move towards both problems one by one. For example, if we take about food wastage, although we, waste in excess of around 14 million tons of food, which is documented, undocumented might be even more than that. But no sort of concrete study still has been done on the actual amount of food waste that is happening in Pakistan. Now, if you don't know the problem, how can you propose a solution, right? So globally, there has been a lot of research being done specifically to this problem, because people are slowly beginning to realize that the concept of a circular economy, the concept of a sustainable economy mandates that resources are utilized optimally. And the fact that we haven't been able to do so, I think that's a very crucial factor. Because if you see the entire food supply chain, which starts from farms, then goes to producers and manufacturers, then to retailers, hospitality, and finally home, there is a vast array of reasons why food is wasted in each domain of this food supply chain. Yet we still have a lot of legwork to do in terms of knowledge. The good thing is that a lot of young entrepreneurs are coming up, but still there's a lot of room to be done, work to be done in order to create a facilitating environment for these folks, especially at the policy level. I remember we have been working with a lot of other people in this food ecosystem and actually drafting policies, legal policies, to actually mandate restaurants or hospitality to supply their excess food rather than dump it to waste. So there's a long way to go in that regard. In regard to your the first bit, hunger, food insecurity, I think this is something that really came to surface during COVID. So conventionally or anecdotally speaking, you would quite often hear this term that there is no hunger in Pakistan. There are so and so shrines and there are so and so hungers. How can anybody stay hungry? I think because Pakistan does not have that first level of a social safety net, at least for hunger, the aftermath of a COVID situation, the hunger situation was something that was waiting to happen. And as risk we were trying to advocate for this for the last 5 years, because even in this, Pakistan, we spend around $2 billion worth of food-based charity each year. And, the COVID, saw a spike in this as well. But still, because there wasn't any national centralized effort to, identify beneficiaries, to supply them with food, there was a lot of resource duplication and there was a lot of effort going to waste. So I think on one level, we have a lot of food. We are one of the best kids in the world, but the idea actually comes down to is efficient channelization rather than producing more. We do produce enough already. It's just the amount of effort that needs to be put in its channelization. And I think this is where ventures like ours and ventures like, of the same nature come up and try to bridge the gap and create a marketplace so that the information asymmetry that lies at the heart of this resource inefficiency that would be catered to.
So thank you so much for joining us and raising those very, very important points, giving us more insight into how these things work at a very localized, at a national level, because it's important to take these discussions and contextualize them, something that has been reiterated by all our guests who joined us today in this segment. That was Musa Amir joining us from Lahore, who was a co-founder of Risk. We're going to go for a short break now, but when we come back, we take a look at why mental health continues to be one of the most neglected sectors in health systems. Stay with us. Welcome back to the show. According to the World Health Organization, close to 1 billion people are living with a mental disorder, and one person dies every 40 seconds by suicide. Despite this, on average, countries spend only 2% of their health budgets on mental health. An estimate if we are being generous in some cases. How can we make mental health more accessible and support greater focus on it? That's our conversation today. Joining us for it, Dr. Andrea Fiegl, who's the CEO and founder of Washington, D.C.-based Health Finance Institute. She is currently leading a sustainable development goal on innovative health financing for neglected global health issues, including issues related to chronic mental health. She joins us from Washington, D.C. Also joining us today is Dr. Kinza, Naeem, who's the CEO and co-founder of Umang Pakistan. Umang is Pakistan's very own 24/7 free-of-cost telephonic counseling mental health helpline, which has also been recognized by the World Health Organization. She joins us from Lahore. Thank you both for joining us and giving your insight into this very, very important matter. Dr. Andrea Fiegl, let me begin with you. Now, let's just go back to that figure, which is 2% is dedicated to mental health care of health budgets on average in countries. Why such a negligible amount?
Very little training, consequently, that allows the diagnosis and the care. For example, we talked to an official from Sri Lanka a while ago, and she told me that they had virtually a zero budget for mental health. So the reason is just it's under-recognized, and there's a massive stigma around having a mental health disorder, yet the problem is quite large globally and especially in developing countries.
Dr. Andrea Fiegl, states figures that almost every 40 seconds there's a suicide in the world. Almost 1 billion people are suffering from mental disorders. How is it that this continues to be ignored? Do you think it is because there isn't enough awareness on it, or because the efforts made to actually address it are continuously being undermined?
Dr. Tedros called chronic conditions a slow-moving disaster. So, for example, as bad as the COVID pandemic is, everyone can be infected by it, and it's a very fast-moving virus. Mental health conditions can cause people to suffer in silence, and there has been a lot of stigma when you think about in terms of hysteria, in terms of acting out when people have bipolar or schizophrenic disorder, so that a lot of people try to hide it. So I think that is one of the main reasons, and as unfortunate as COVID is, it does shine a light on chronic conditions, including mental health. So we do have a window of opportunity to push for legislation and to push for some of the solutions that are really very much long needed.
Right. I'm going to come back to that point. It's very, very important to talk about how we can seize this opportunity, a very unfortunate circumstance that has developed, but how we can make the best out of it moving forward. But I'm going to take this question to Dr. Kinza Naeem and go along with this conversation we're having about how mental health is still a stigma. Dr. Kinza Naeem, when we're talking about Pakistan, for example, and the work that you do, which is supposed to be free of cost, how does stigma still act as a barrier to prevent people from reaching out, even to a free of cost service?
It's such an important issue, especially like post-COVID. Basically, at a place like Pakistan, issues regarding mental health are still not recognized. They're still not considered real. You see, reaching out is the second step. First, you have to identify there's an issue. At a place like Pakistan, the identification is not there. People don't think being irritable for more than a week, say, or not being able to get out of bed for, say, more than 2 weeks isn't normal. They just say they're probably like just irritable because of some circumstances or anything. They just tend to ignore such cues, such very important cues. So the basic issue at Pakistan is identification of the issue. Then when a person identifies it, that, okay, there's something wrong with me, and I need to seek help. I need someone else to intervene. So then when it's the time to actually, they start somehow looking up for services that are obviously, again, that's totally another different topic. There are not a lot of services in Pakistan, but then they look up and they look up for helplines or free services. Still, they would not go or they won't plan on going to the clinic. They would just call us up, just checking out if the whole counseling thing works or not. And then after 2 or 3 sessions, they would be like, oh my God, this thing is actually working, and they would continue their therapy. So basic issue is identification, I think, at a place like Pakistan. A lot of people, they don't know they're going through this. They don't know how their life is upside down, but they're not just identifying or realizing that their brain is not well. So,
right. Yeah. Dr. Kinza Naeem puts forth a very, very important term or a very, very important phrase when we're talking about this, which is that people don't consider it real enough. Dr. Andrea Fiegl, not considering it real enough might be because people undermine or underestimate the consequences of having mental health issues. But take us through those very real and tangible consequences, not just for the individual, but society, the economy, how we function as a country.
Yeah, so it is estimated that about 16 trillion in economic losses will occur due to mental health conditions, such as people dropping out of the labor force, dying prematurely between 2010 and 2030. And that is almost $1 trillion a year. And that was pre-COVID. So these effects will even be harder. Currently, we have an issue of burnout in physicians, social isolation of caregivers, of the elderly, and especially of children who haven't been able to go to school, including in the US, haven't been able to return to in-person school in many of the schools. So that can cause a sort of a spiral of both social and economic degradation, because mentally ill workers, depressed workers contribute less to society, and it can lead to community disintegration as well as economic losses. So there needs to be a recognition of that first at the policy level, and there needs to be a really fast scale up of solutions, such as, for example, in the digital and the AI space as a first cut solution to that.
Can you give us some examples of that? We hear about technology intervening, but we also hear the drawbacks of it, especially when it's related to jobs and services that require empathy. So how can technology and AI intervene in something like this?
Thank you so much for this question. And in addition, there's another issue around privacy, that people who seek care might be worried that their information is gathered online. But that being told, now with cognitive behavioral therapy, with a lot of research out there, we do know that certain interventions can actually be delivered either via telemedicine or through simple text messages, just in terms of to nudge persons and to start understanding and diagnosing a problem, and then directing them to an actual in-person professional when that is needed. So it's often sort of a multi-tier digital solution that helps in terms of text services and early diagnosis and directing to clinical providers when needed.
Right, and Dr. Naeem actually does the groundwork on this. Dr. Kinza, creating that system, that multi-tiered system that involves several types of technology, how beneficial do you see that being, especially when we're talking about trying to deal with what experts are warning of an impending mental health pandemic?
Okay, so basically technology, if I talk about Pakistan, if we only involve technology in it, we won't be like catering everyone. I mean, we want to reach out to each and every person. So still in Pakistan, not everyone has a mobile. But yes, via technology, there are many platforms who are actually using it. And via technology, there's certain stratum of people who actually do reach out and they're catered. So I don't, if I talk about Umang, my technology part would be included more of like for catering the corporate side. For general public, for students, for reaching out to people in general, there's this telephone number on which there are operators, and they would just ask for their basic information, like their basic biodata that helps us determine what's the severity of the issue, and that person needs venting, or it's something complicated, or it's suicidal, actively or passively, his suicidal attempts and everything. And then we, accordingly, we gauge that, and then we direct that person to the appropriate or whatever selected psychologist we actually gauge to begin with. So then there's there's a session from say 30 minutes to 1 hour that is conducted by clinical psychologists, and further, if required, and if the client needs and intends to, he's given follow-up sessions. So this is because, you see, I personally think at a place like Pakistan, post-COVID things are changing, and I'm happy that some corporate sector, both private and the government, is actually thinking it's an issue, because you see, this according to this recent research.
Dr. Kinza, let me just interject here. And you're talking about this post-COVID situation in which mental health is being deemed as a more important issue. But I want to move a step back and talk about what really happened during those couple of months of lockdown, during the situation in Pakistan when there was a great social isolation. What type of response or what type of reaching out did you see by individuals on your hotline?
Okay, so basically, Meshal, one thing that was really different from the norm was there were a lot of men who started calling. I mean, if not more than women, the numbers are pretty much equal. Before that, men weren't like seen on a hotline, to be very honest. But a lot of men started calling, I mean, because there's this, you see, uncertainty about the future, economy crashing, and they don't know what the future would be, what the future has for them, and the laying off thing and everything. And then the men in general in Pakistan, they're not like used to staying at home. You see, so there are a lot of even women calling us up saying that their husbands or their sons, they're being violent or like they appear frustrated, and they never saw that streak before COVID. Then there were people who were actually prone to panic attacks. It was a nightmare for them. I mean, constantly thinking about COVID, because back then the numbers were pretty like flamboyantly thrown around, the figures. Like we were getting calls from Gujranwala saying that this is the number that Gujranwala has now of COVID patients, and I'm basically scared I would get or contract that too. So I mean, the numbers and everything. Then they were hypochondriacs. It was a nightmare for them too. I mean, right. Hypochondriacs are people who actually like, I mean, even if they get like a mild cough, they think they're having TB or something like that. You see, so constantly having that fear of contracting the illness. Then OCDs. Oh my God! If they used to wash, like say, their hands 10 times a day, they were now doing it, say, 25 times a day.
You had to confront. Organizations saw a very, very different wave of responses, a very different type of wave of the type of issues. And you point towards how gender, in fact, became something very noticeable here, how men were reaching out more. That's such an important observation there. And it's, of course, so much more important to dig deep into that. But since I'm pressed for time and I really want to get this in, Dr. Kinza, Naeem, on a national level, your organization playing its own role, but on a national level, what type of policies are needed in order to address mental health better? And then I'm going to take the same question to Dr. Andrea Fiegl.
We need mass trainings, Meshal, because the thing is, we have psychologists. They're not certified in everything, but we have psychologists because there's no supply because of somehow the taboo and the not thinking mental health is a real thing. So there's no supply, and that's why the demand is not there. But right now, more than 40% of our population is suffering from mental health issues, according to this recent research by, this is another newspaper that was published back in July 2019, more than 40%. And in Pakistan, we lose one person to suicide every hour. Again, this is an understatement. It's because obviously the legal and the religious, definitely an underreported thing, because obviously the legal aspect and everything related to this. So thing is, and then obviously according to the global research, there would be the next pandemic we would be looking at is mental health issues, and the most vulnerable age bracket is 15 to 30 years, and not to forget, 65% of our population is.
Right, we have a youth pulse right there.
Right, 15, 30, yes.
Right.
So the government right now has no policies regarding mental health. It's just related to people who are mentally retarded, their rights in property and stuff. Nothing in particular.
Right.
But yes, mass
we
training
need greater intervention there. We need more intervention there. I'm sorry to cut you off there, Dr. Kinza, Naeem, but I have to put this to Dr. Andrea Fiegl. It's such an important question. Dr. Andrea Fiegl, I want to talk about innovative financing, and especially for countries like Pakistan, more developing nations which are short on resources. I know this is a global issue, but countries that are completely neglecting this, not even dedicating 2% of their health budgets to it. How can innovative financing, what mechanisms are there to explore in order to get to that point where we can make this a priority?
Absolutely. So innovative financing can help by basically guaranteeing outcome payments and payments back to the investor if certain targets are being achieved. So for example, one target could be task shifting, and one target could be the training that your colleague mentioned is so important. So that but then the donor or the government would only have to carry the bill if these targets are actually being achieved. And these mechanisms are called social impact bonds or development impact bonds. There's also line of credits or blended finance that could be deployed, where World Bank loans or loans from development banks could leverage additional private capital, such as from the telecom providers, or small user fees based on ability to pay could be levied on users of these digital care apps. So there's various innovative ways where you can bring basically private and public capital together, because there's going to be a benefit, for example, for insurers, for employers, as well as for the health of individuals. And when you integrate those in the instruments that we offer, you could have new solutions that will actually then provide the scale of care that is really needed in this emerging pandemic of mental health disorders.
Right. Thank you so much for that insight, Andrea, Fiegl, and Dr. Kinza, Naeem. Of course, this is such an important topic, and there's so much to talk about. A segment is nearly not enough, but we're going to continuously update our viewers on it, what's happening, what can be done in order to address these issues, and how important it is to, in fact, talk about them. Thank you to both our guests for joining us, and thank you for watching Indus Special. We will see you again tomorrow with more stories. Till then, goodbye and take care.